And welcome to Early Years TV with me, Kathy Brodie. Today is all about children's health, our health, and indoor air quality. I'm delighted to be joined today by Marie McConway. Marie spent 9 years working in primary schools as a class teacher. After completing her Masters in Education, she moved into higher education teaching where, since 2017, she has taught the Early Childhood Development and Learning undergraduate course at CU Coventry, and has also worked with Coventry University ITT trainees, authored online PGCE primary course content for the Future Learn platform. I love that platform, it's so good. Spoken at the Night Annual Conference, and she also works for the Skills Network, delivering their early childhood online courses. Again, the Skills Network are fab as well. Marie works with the Long COVID Kids charity, advocating for improving indoor air quality and raising awareness on the ongoing impact for COVID on children, which is very, very relevant just at the moment. A very warm welcome to Early Years TV, Marie McConway.
Hello, thanks for the intro, Kathy.
Oh, you're doing some really, really interesting things and work for some great places. And so you obviously know what you're talking about here. I think that's kind of sums that up, doesn't it, there? But we're going to be talking today about indoor air quality. And one of the reasons that I was sort of interested in having you on here is because I've heard nobody else talking about indoor air quality. As far as I'm aware, it's a bit of a mystery at the moment. So let's start off right at the very beginning with the definition. What is it that you actually mean by indoor air quality?
So, indoor air quality refers to the condition of the air inside buildings and its impact on the health of its occupants. It's important to remember that the quality of the air inside is not the same as the quality of the air outside. It becomes polluted by things like gases and particles, mould, and airborne diseases. We can easily clean the indoor air by monitoring the carbon dioxide levels, filtering the air, and improving ventilation.
The carbon dioxide level also is the thing that we need to be aware of, and we can measure, which is what I want to sort of talk about today. So if you have a very high carbon dioxide level in your room, then it means that we need to take action to improve ventilation or filter the air.
Yeah. Wow. I mean, this is the thing, isn't it? Because you can't see it, you're not aware of it. I mean, if it was a smoke-filled room, you would know there was a problem, wouldn't there? But because you can't see it, that's then a problem. But I mean, this isn't a new problem, is it? There's been pioneers, I mean, early childhood pioneers, to be fair, throughout the ages that have considered air quality and having children outdoors, haven't there?
Absolutely. So looking back in history and thinking about before we had medical advances like vaccinations and antibiotics and antivirals, we all relied on these what's called NPIs, non-pharmaceutical interventions. And to prevent the spread of diseases and to improve public health, it was widely understood that diseases are in the air that we breathe. And these principles were outlined by Florence Nightingale, Lady with the Lamp, and she wrote her seminal work where she talked about the importance of good ventilation and the idea that we need to do no harm. And she said that the first rule of nursing is to keep the indoor air as pure as the air without, so the outdoor air. So that was one of the fundamental things that she wanted to get across to people who were going into nursing. But we also had the early years pioneers, which people might be familiar with, the Macmillan sisters, who during the 1918 flu pandemic set up their outdoor nurseries because they knew that having the children outside and the children breathing fresh air would mean that they were less likely to catch the flu, the influenza of the time, and other airborne diseases that were rife, such as tuberculosis. And they found that with their outdoor nurseries, doing everything with the children outside and making sure that that those things couldn't spread, the children's health and well-being was protected.
Yeah. So, I mean, right. So this isn't a new thing. The Macmillan Sisters was like 120 odd years ago. Florence Nightingale, 100 years before that as well. So this isn't something that's just on the modern world, is it? This has been around for a long time. So why is it that we need to think about it now? Why is this now important?
In some ways, I think we have forgotten some of those things that we knew. So thinking about the air quality, I think we've fallen into an over reliance on medical interventions to help us with diseases, and we do have guidelines for infection prevention and control, but often the focus on infection control in educational settings is about cleaning. And so cleaning surfaces, and that obviously is beneficial, but it's not beneficial for airborne diseases, which so we're sort of missing. We're missing a huge part of what we could and should be doing in terms of preventing infection and transmission of diseases.
Yeah. And of course, COVID has thrown that into sharp relief, hasn't it?
Absolutely. And I do feel that there's so much scientific information that has accrued in the last 5 years about the airborne transmission of diseases. And so we've got all of this knowledge that we aren't using, we aren't implementing it. And it's a golden opportunity really that we're missing at the moment. So yeah, it's something that we could be doing so much more about.
Yeah. And of course, even though we're now 2025 when we're recording this, and COVID was like 5 years ago or thereabouts, we are still seeing the echoes of I mean, apart from that, we don't know when we're going to get a next pandemic. So maybe we should be thinking about that. But that aside, we are still dealing with some of the long COVID effects from the 2020, aren't we?
Absolutely. So much of the rhetoric about COVID, which when you hear people talking about COVID now, it's often in the past tense. So people will be sort of talking about during COVID, and that's problematic in itself because the pandemic isn't actually over. The emergency phase of the pandemic was ended by the World Health Organization, but the pandemic, despite the contrary to popular belief, is still ongoing. And the rhetoric about the impact of COVID on children is very much about the impact of the lockdown that we had and the impact that had on children's development. And very little attention is given to the direct impact of the virus on children's health.
So what about the long COVID then in children? Are we seeing any of that now? Because we are, as I say, we're 5 years down the road. Are we seeing anything of that?
Yes, we are. Unfortunately, we know now that long COVID does affect children. So at the very beginning of the COVID pandemic, it was falsely assumed that COVID didn't affect children. We're 5 years down the line, and there is now a huge amount of research which shows that children are affected by COVID, and it is impacting on their health. So just to give you a couple of statistics, we know from the ONS survey, which looked at long COVID in children between March 2023 and March 2024, they found that there were over 111,000 children suffering with long COVID, and that was just in England and Scotland. And that figure had doubled within that year. So the idea that it is something that is in the past or something that is historical, something that is no longer a concern, is incorrect, because we can see that these numbers are still increasing, which is obviously extremely worrying. Well, I just also wanted to point out some of the symptoms, because I think the term long COVID in itself is not very well understood, and so thinking about what it might look like in children, there's lots of evidence about how COVID impacts on children's health. But just to give some examples, there is an image which I could share, at this point, which demonstrates the multitude of ways in which COVID affects children. It includes the cardiovascular symptoms, neurological symptoms, speech and language difficulties, mental health and behaviour issues, respiratory issues, an increased incidence of childhood type 1 diabetes, and gastrointestinal problems. So it's not, I think there's a misconception about long COVID, where it's just feeling a bit tired and fatigue. Although fatigue is part of long COVID for many people, it's just one symptom of many that you can experience.
Yeah. I think the additional worrying thing for children is because their systems aren't fully developed, they're unable to fight that as effectively. And things like diabetes, you then carry for life, don't you? I mean, this is long COVID, isn't it?
There was some other research just thinking about the youngest children. The research from September 2023 to April 2024, it was found that 1% of all babies under 6 months old had a hospital stay as a result of COVID, which is a huge number of children. And the hospital admissions for children under the age of 1 has never gone down throughout the entire pandemic. So it is still affecting children, and it is a concern and something that we should be dealing with.
Yeah. So tell me, what does the Long COVID Kids charity that you're involved with, how can you then support and help people in this situation?
Okay, so the Long COVID Kids charity is it's an amazing organisation, and they are supporting children internationally all around the world. Their website has got lots and lots of information, lots of the academic research is there to view, but it also has information for people who are working in education. They've got something called an education toolkit, which gives advice to schools and settings for how best to support children who are struggling with the long-term effects of COVID.
Yeah. Well, absolutely essential, because the statistics tell me that you will have somebody in your setting right now today who is suffering with that, without a doubt. Yeah. Or could do with the extra support, maybe. Yeah. Wow. So, right. So let me just take you down a bit, Anne-Marie, to more local then. What is it that we can do? All right, let's start from the beginning. How is it that airborne diseases can affect people in a setting then? Why particularly in an earlier setting or a school?
Okay, so I have got an image to share with this bit as well. So thinking about which diseases are airborne, it's not just COVID that's airborne. We know that COVID is airborne, but there are many infectious diseases which are airborne, which we could be preventing the transmission of. So if we can think about COVID, we can think about flu, we can think about whooping cough, we can think about measles, we can think about RSV. So there's so many different serious childhood illnesses which we could be preventing if we were monitoring and improving the indoor air quality. And I think if we were aware of the multitude of illnesses which we could be reducing the impact of, then I think we would all feel very motivated to act. But we know that schools are poorly ventilated often. So at the beginning of the pandemic, the government did give out some CO2 monitors. I have a CO2 monitor here, which I can show you. And so £27 million was spent by the DfE giving out these CO2 monitors to educational settings. So hopefully quite a lot of schools and nurseries already have access to one of these monitors. But yeah, there's if you use your CO2 monitor, then you can have it gives you an insight into the quality of the air, the room that you're in. So I can give sort of a few pointers about how to use your CO2 monitor and things and actions to take if you'd like. So according to the government guidance, they recommend that we introduce improved ventilation in our settings. So they already recommend opening windows and doors, letting in fresh air. And they say if you have one of these CO2 monitors, then you can use it. You should be using it. But in terms of the figures on your CO2 monitor, ideally you would be looking at keeping it around 800, so 800 parts per million. The higher the CO2 level, the more you are going to be breathing in other people's exhaled air. So if you've got a very high CO2 reading, that means that there is likely to be a lot of exhaled air that you're going to be breathing in. And it doesn't tell you exactly how many viral particles are in the air, but it is a proxy measure. So if you've got a very high reading, you need to basically act. So the highest level, so where the government guidance says we need to take action, is if it goes over 1,500. So which I would say you need to act before then. And other countries have set that target lower than our government have. So in France, for example, they have just introduced legislation and they say they want people to keep it at 800. But using your CO2 monitor, you can have an indication of whether or not you need to do something. So do you need to get some air filters in the room? Do you need to increase the airflow somehow? And it doesn't, I know if it's cold, you don't necessarily want to always have the window open, but you could just open it for 5-10 minutes, get a blast of fresh air in, and that will decrease your CO2 level. If there's no windows in the room, then you can get a HEPA air filter into the room, and then that would be cleaning the air and taking all those viral particles out of the air that you're breathing. So yeah, if we were to all take these steps in educational settings, it would have a significant impact on health and well-being for staff and children.
Yeah. And I have to say as well, just opening the window and having a blast of cold air, that sounds quite nice. I mean, there's other benefits as well, aren't there, really?
Yeah, well, absolutely. So yeah, I have got some information about some of the other benefits, because it's not just obviously my concern is about infection prevention and control, but there's loads of evidence about additional benefits. It increases your cognitive function. It decreases respiratory symptoms. So asthma, we know that every class will have 2 or 3 children who are suffering with asthma. So it decreases their symptoms. It also, I mean, obviously the government is very concerned about attendance figures. So if you are decreasing the amount of illness in the setting, that is going to improve attendance as well. And yeah, as I say, it doesn't just remove those viral particles from the air. If you filter the air, it also removes the pollutants, the dust, the pollen, the mold spores, and all the other contaminants. I think it's also important to mention that it's also about inclusivity and accessibility as well. So I'm very keen to explain to everybody the importance of reducing the amount of illness, but I think it's about expanding how we see inclusivity and accessibility for people who are clinically vulnerable. So rather than thinking, well, you know, they're probably going to be okay in the classroom, if you've got clinically vulnerable children in your class or staff in your setting or family members, then catching these airborne diseases can have a really serious detrimental effect on their health. And so making sure that we are thinking about the indoor air quality makes it a safer environment for everybody, and it provides that level of inclusive practice and reasonable adjustments for children and their families. So.
And I wouldn't just say children as well. I am thinking of, I know teaching assistants and teachers who have been clinically vulnerable, who have been in classrooms, and, you know, it's better for them, isn't it? And is it, so you're telling me it's as simple as either getting an air filter or opening the window? Is that, I mean, is it really that easy?
Well, there was a study that was commissioned in 2021 by the government called the Class Act study, and Professor Capnopes was the lead on this study. And the results of the study, which came out just recently, showed that using air filters and improving the indoor air quality had a significant impact on the attendance in settings. So it reduced the amount of illness by and improved attendance by 20%. And the conclusion in that study was that it's not a panacea. So filtering the air is not going to completely eradicate all illness. However, it will significantly reduce the amount of transmission of airborne diseases. So it's not going to be the answer, but in the same way that we clean surfaces and try, and so if there's norovirus, we would make sure that we are getting out the detergent and cleaning the surfaces. That doesn't guarantee that it's going to not spread in the setting or wherever you are, but we still do it. And so I think we have all of these guidelines and we've got the government advice, but I don't think that most people are really thinking about the indoor air quality. And so the guidelines are on the government website, and it clearly says that the recommendations are that we need to be monitoring the CO2 levels and taking action if there's poor ventilation. And so the guidelines are already there. So it's just implementing them and understanding that it's actually quite achievable, and it also doesn't cost the air. So buying a CO2 monitor and buying air filters, if you invest in those things, there will be benefits. So there will be cost benefits because you will have fewer staff off sick. There will be obviously the health benefits. It will be a more inclusive setting. So the cost of not doing this, I think, is far higher than investing in cleaning the indoor air.
Oh, absolutely. As you say, it's all very well having those guidelines on the website, but if you don't know that they're there, you're not going to go and look if it's never crossed your mind to even go and search for it. So I will make sure that the direct link is in the words that go along in the video, so you can click through and have a look at that. And as you've already mentioned there, actually, that that's our government, that's the government in England, and that's their guidelines. But France is doing something different. I mean, how are other countries, how are other places dealing with this? Because we all have indoor air, don't we? So
so there are some fantastic examples internationally. So if we make comparison, I've got a really good image for where the UK sits in terms of guidelines and regulations, carbon dioxide levels that are acceptable. But it's just to give some really good examples. Latvia, for example, have got they monitor the air quality in 14,000 educational settings, and so the air monitors are in the classrooms, and the information is the data is analysed, and if it's found that the air quality in any of those educational settings is poor, then action is taken. There's also that's also happening in Germany. There's a place in Germany where they are centrally they've got CO2 monitors monitoring the air quality in lots and lots of different settings. If it's found to be poor, then action is taken. It also happened in Boston, in America, quite recently. As I say, France have got regulations. Our country have just got guidelines. So obviously, if it's only guidelines and those guidelines aren't being enforced or encouraged or monitored in any way, then that's not going to be as powerful as having regulation and making it mandatory to think about these things. So ideally, looking to the future, it would be much better if we improved our standards that we're expecting, because we've set the bar quite low with 1,500 ppm. So improving the standards that are expected, and also making it regulations rather than guidelines. Would be good. Yeah, that would be really, really nice. And promoting the fact that there are guidelines, that would also be quite good. Yeah, it would be good if someone knew about them. Yeah,
that's right. Yeah, right. So guidelines are one thing. That's obviously the data. That's the facts and figures. But if you had a look, I'm just thinking now, there'll be people watching today going, I know that my classroom gets stuffy because I'm in a totally internal room, opening the doors. And I know where can they go for advice, support, help to actually deal with that then?
Okay, so there is a fantastic project which is called the SAMHE project, which is spelled SAMHE. And what they're doing is you can still join up. You can still you can go to the website and you can join up and you can get all of their resources. So what they did was they set up this project, and what they're looking at is monitoring indoor air quality across, I think it was 1,000 monitors they sent out, to double check that, but they sent out these CO2 monitors, and they are collecting the data and analysing it. So that's an ongoing project. But if you are thinking, what do I need to do? How can I get some more information about this? Their website is amazing. And they've got lots and lots of really good information on there and advice for how you can improve the indoor air quality. So I would recommend that as a really good resource. There are also other websites. There's a website called Clean Air Stars, and they give advice about how to choose an air filter, which air filter is best to buy, because it does depend on the setting and on the space. So not all filters are the same, and some filters are better than others. And so getting a bit of advice about that. And yeah, so there is information out there. The teaching unions are also good sources of information. They have advice on their websites. There is a DIY version. So some settings took the route of the DIY air filters. So they're called Causey Rosenthal boxes. So that's two people that invented this DIY air filter. And so some schools have gone down that route because it's cheaper, and you can use it as like a STEM project with children, get them involved, get them thinking about the indoor air quality. And I think that's a really nice way to do it as well. So if you go on the SAMHE website, they've got teacher resource packs so that you can do these activities with the children, so that they're learning about indoor air quality at the same time. So they're on that journey with you. And you can have monitors and people who are checking the CO2 for you, and then it's not all on the teaching staff and educators to be thinking, oh, what's the monitor saying? And if you've got the children involved in it as well, and they're understanding what needs to happen, then I think that makes it easier to do. Just to recap, we have got a poster from the Long COVID Kids charity, and this is what the parents of children who've got long COVID would like to be happening in educational settings, and this is what the children would like to see to keep them safe in the environment. So there's 3 simple steps. If you can monitor the air quality in your room using your CO2 monitor, and aim to keep it around 800 parts per million, and definitely take action if it's getting up to or above 1,500 parts per million. Filter, so invest in a good HEPA air filter, or build your own DIY Causey Rosenthal box so that you can remove those viral particles from the air and clean the air that everybody is breathing. And ventilate, so filters alone will not reduce the CO2 level, so can you ensure that you are opening doors and opening windows so that fresh air is allowed into the room to disperse those particles?
Yeah, absolutely. And it's interesting that you mentioned the unions as well, because they obviously represent the adults in the setting. So there's obviously concern for the adults, as there should be. If that's your working environment, you should be entitled to that sort of cleanliness, I suppose. As you say, you would expect it if you were cleaning down surfaces. Why would you not expect it for cleaning air? So what are unions and other establishments doing as well?
Okay, so there is... The unions have got together and they are offering a webinar on the 5th of March, which is all about indoor air quality and how to improve indoor air quality, and giving people who are working in educational settings advice and top tips on the simple steps that they can take. It certainly is something that is affecting the adults as well. So I have spoken about long COVID in children, but clearly teaching staff are disproportionately represented in the long COVID figures. We don't have data on exactly how many education and teaching staff have long COVID, but we know that the recent numbers from the GP patient survey, they found that they estimate that there's 3.1 million adults at the moment that was July last year, who've got long COVID in the UK, and there have been studies previously that demonstrate that people who are working in educational settings are at very high risk, in the same way that healthcare workers are, due to heightened exposure. So yeah, I think it's important for everybody who's working in an educational setting to just know about this, because I think information is power, and so we can't really wait for these government guidelines to become regulations, because it's going to take too long, and we can't wait for them to act. So in the meantime, I would just really like for people to have this information so that they understand that they can take this action themselves. And yeah, I'd like a clean air revolution. That's what I would like to see.
So if I did give you a magic wand and said, right, I'm going to take you, transport you into the future, 10 years into the future, what would you like to see happening in the future?
Okay, well, I mean, the Latvia example that I gave earlier on, where they have got CO2 monitors in educational settings, where the information is being monitored and acted upon. So we need to have regulations rather than guidelines. We need people to understand how they can address this. So I just would love to see better public health information. I feel like that's what's missing at the moment. We don't have good public health information being given out to people, so they aren't really aware of the risk. And so ideally, I would like people to be better informed about the risk in terms of what these airborne infections can do, and specifically COVID. And then I would like the guidelines to be improved and to be more aspirational than they are, because we can definitely do better than the current guidelines.
Oh, absolutely. And the fact that other countries are able to do better shows that it's not because the technology is not available, or we could do if we had a look around and we could learn from that. And I mean, ideally, it'd be great if it could start from the early years settings in schools and drive that forward with the government to say, we want our teachers working in safe environments. You wouldn't expect us to be working, without disinfectant to clean the surfaces. So we would hope that you could keep our air clean as we keep our everything else clean. No, I'd absolutely agree with that. Wow, it's such an interesting and vital topic for everybody's health, children's health, our working lives, because as you say, if you get long COVID, that's going to affect all sorts of things. That's not just a cold for a week, is it? That's something hugely different. So I think it is such an important area. I really, really appreciate your time sharing that with us, Anne-Marie. I know that you do other things as well. You do, as I said in the introduction there, you've done all sorts of lovely courses and online tutoring and all sorts of things. Where can people find out more about what else you do as well as indoor air quality?
I'm on social media, so I'm on LinkedIn and I'm on X and on Blue Sky. It's kind of my mission really at the moment is to raise awareness of indoor air quality. So yeah, if you did want to follow, then I share as much information as I can about improving health, improving indoor air quality. So yeah, I can share those links with you.
Oh, that's brilliant, Anne-Marie. Thank you. Yes. And I would urge everybody to follow and to sign up and to like on those. And as you said there, you're writing articles, you're putting out things the whole time about the research. So if you do need that research to back up with the senior leadership team, or even just for your own interest, do give that a read and click through and join Anne-Marie there on the socials as well to follow this conversation. And if you're able to, put pressure on the government as well to start getting some of those regulations in place. Wow. So interesting, and I'm sure I would love to come back actually and revisit this in a year's time to see how much progress we've made and to see where we're up to. But for the moment, Marie McConway, thank you so much for coming on to Early Years TV and talking about such a vital and interesting topic with us. Thank you very much.
Thank you. Thanks for having me.
Oh, you're very, very welcome. And I look forward to welcoming everybody to the next session on Early Years TV.